What began as a 45-bed hospital housed in an early 1900s apartment building and grew from the vision dreamt by founders of the great city of Fort Lauderdale, today represents one of the 10 largest public healthcare systems in the United States, with more than 10,000 physicians and employees who treat more than 50,000 admitted patients annually. And tonight, are joined by more than 500 of our friends, colleagues, and neighbors. We are Broward Health. Good evening, everyone. I'm Joe Roach. I'm the weekend anchor for WSVN Channel 7, and I'm your host for tonight. Welcome to Broward Health's first ever State of the System address. A quick story about myself. I moved to South Florida back in 2016, and I spent a year looking for where I wanted to live before my family and I settled down. I have 2 young girls, and finding the right healthcare system within the right county was paramount to me, knowing that we would have the resources we need when it came to healthcare. Broward Health in Broward County was that system. Enough about me. Our first guest is Stacy Angers, Chair of the North Broward Hospital District Board of Commissioners. Chair Angers has served on the Hospital District's board since 2018. She is also a board member for Children's Diagnostic and Treatment Center, an affiliate of Broward Health, and the League of Children's Schools, of Christian Schools. She is the principal of Abundant Life Christian Academy in Margate. Chair Angers, welcome.
Thank you, Joe, and good evening, everyone. Welcome to Broward Health's State of the System address. Tonight's event is in celebration of an 85th anniversary of our healthcare system. Throughout the program, we will look back on Broward Health's incredible accomplishments throughout our past 8 decades while we continue to look to the future. But first, I would like to recognize and thank several special guests here with us tonight. My distinguished colleagues of the North Broward Hospital District Board of Commissioners who are in attendance, including Vice Chair Chris Pernicano, Secretary Treasurer Paul Tanner, Commissioner Ray Berry, Commissioner Jonathan Hage, and Commissioner Levi Williams. On behalf of the board, I cannot tell you how proud we are of how far Broward Health has come and the significant opportunities that exist for our healthcare system. Ideally, I would like to thank each of you individually, especially our federal, state, and local representatives who are joining us today in the audience. But as the great example of their steadfast support for Broward Health and our community, there are just too many of you to call out by name. Mayors and commissioners, legislative aides representing state legislators currently working in Tallahassee, leaders and chiefs from the Broward Sheriff's Office and local police and fire rescue departments, your presence here tonight is recognized by all, and we are grateful for the critical role you play with Broward Health. I would be remiss if I did not recognize a few specific individuals. Broward County Mayor Lamar Fisher and the Broward County Commissioners in attendance. Fort Lauderdale Mayor Dean Trantellis and Commissioner Warren Sturman, also a Broward Health physician, and all of our Fort Lauderdale commissioners. Broward Health, the commissioners, the leadership, are all very proud to serve beside our local representatives and leaders. I also want to acknowledge our remarkable physicians joining us on stage, our chiefs of staff, and our chief medical officers who are with us tonight. As you will learn throughout this evening's program, our doctors have been a vital part of Broward Health's history as they have saved countless lives, discovered new medical treatments, and remained dedicated to the Broward County community. In addition, let's hear it for our amazing chief nursing officers who continue to be such tremendous advocates for our dedicated nurses, clinical staff, and patients. We truly appreciate our exceptional physicians and nurses. Finally, I would like to acknowledge Broward Health's executive team members, including our corporate and hospital leaders. Shane Strum, our Chief Operating Officer, Alan, and our Chief Financial Officer, Alex Fernandez. Along with each of the corporate leaders at our specific institutions. Thank you for your ongoing leadership and perseverance as our healthcare system continues to experience exciting growth and expansion. 85 years. What an incredible milestone. Tonight's celebration is about remembering our past, honoring our present-day accomplishments, and envisioning our healthcare system's future. Then, now, forever, Broward Health will always be a steady beacon of healing and hope for all we serve, for all of Broward County. And we are proud to be an integral part of Broward County's history. I hope you enjoyed tonight's event, and thank you for your continued support of Broward Health.
Thank you, Chair Anger, and I echo your greetings to so many of our region's leaders. To see this theater filled with state and local representatives, business leaders, and first responders truly is a testament to the significant role Broward Health plays within our community. With that said, I'd now like to introduce Dr. James Roach, Chief Medical Officer of Broward Health Medical Center and District Chief of Emergency Medicine for all of Broward Health. Dr. Roach is also the Medical Director for Broward Sheriff's Office, Fort Lauderdale Fire Rescue, and Sunrise Fire Rescue, bringing a very unique perspective to his role. Dr. Roach has received several accolades throughout his career, including the Fire Chiefs Association of Broward County's 2021 Ralph Marinson EMS Lifetime Achievement Award and Broward Health's 2015 Distinguished Physician Award. Speaking to our clinical staff, physicians, first responders, and all in attendance here tonight, everyone please welcome Dr. James Roach.
Good evening, everyone, and thank you, Joe. It is an absolute honor to be here to celebrate our 85th anniversary and to share with you some of our plans for the future. Like many of you, I have a history with Broward Health. I worked here as an emergency medicine physician for nearly a decade back in the early 2000s. And last year, I rejoined Broward Health to lead emergency medicine system-wide and to serve as a Chief Medical Officer for Broward Health Medical Center. I am thrilled to be a part of this healthcare system. Broward Health shares my values and commitment to providing advanced trauma and emergency care for everyone in our community, from the youngest to the oldest. I am also proud to continue serving as Medical Director for Broward Sheriff's Office, Fort Lauderdale Fire Rescue, and Sunrise Fire Rescue. Do we have any first responders in the house? Can you all stand up to be recognized? Thank you for your service. It's an absolute honor to honor you all here tonight. My dual roles with hospital and emergency responders give me a unique perspective on how we work together to advance protocols throughout the continuum of emergency care. By partnering with emergency responders to implement state-of-the-art treatment modalities, such as whole blood and trauma resuscitation, we have the potential to significantly improve outcomes for all types of emergency patients. Over the course of the pandemic, those of us in healthcare and public service learned how important our partnerships are in times of crisis and uncertainty. Thanks to our relationships with local governments and other organizations, Broward Health was one of the first systems to offer drive-through COVID-19 testing. And in 2021, Broward Health partnered with Inter-Miami CF and the City of Fort Lauderdale to host one of the largest community vaccination sites in the area. These initiatives were a success thanks to our partnerships and the efforts of our healthcare providers and staff. I would like to take a moment to thank everyone in the Broward Health family and all first responders who supported us, helping to protect the health and wellness of the community we serve during one of the greatest public health care challenges in generations. We also would not be where or who we are today without our people at Broward Health, and it's definitely the people who make Broward Health great. I am grateful for the nurses, technicians, support staff, our employed and community physicians, who are all focused on delivering quality health care to all we serve. Their dedication became very apparent during the pandemic, and it will not be forgotten as we look to the future. While we celebrate our 85-year legacy of service to our community, we are equally excited about opportunities to advance patient care and to enhance the physician experience here at Broward Health. We are aware that challenges exist, yet the opportunities to optimize our operations and the experience of our physicians are palpable and will ultimately enhance patient care. We recognize our physicians' collective pride in caring for our community. And as an emergency physician, I, like many of you, am particularly proud of our role as a nonprofit safety net hospital. It's also thrilling to practice medicine in an environment that allows creativity, innovation, and broad clinical range. Many doctors are attracted to Broward Health because of our wide variety of cases that are presented. And Broward Health has incredible range of pathology. Our leadership has identified opportunities to foster better physician connection and collaboration across facilities, to ensure that everyone is well informed about our service lines and what we can offer our patients. Focusing on cross-facility communication will enable more patient referrals and within our system and provide more holistic care. We realize physicians feel deeply connected to their individual hospital's culture and administration, but we have room to grow by creating a more consistent system-wide culture, a Broward Health culture. Doing so will allow us to better serve our patients and communities now and in the decades to come. And that is what it's all about, continuous enhancement to better serve our patients, constant improvement. Thank you, doctors, for your long-standing support for Broward Health. And on behalf of the medical staff, we thank Broward Health's leadership and our Board of Commissioners for their ongoing support. And finally, I would like to thank the community partners and first responders who have joined us here tonight. Your engagement with us means more than I can say. Thank you from the bottom of my heart.
Thank you, Dr. Roach, and to all the physicians and first responders in our audience here tonight. Where would we be without you? Now we turn to the heart of tonight's programming, that is, the state of the system. In a moment, you will hear from Broward Health's President and CEO, Shane Strum, as we recognize Broward County's founding healthcare system. And together, here tonight, at this moment in time, we establish the collective destiny of Broward Health and our community. For even as Broward Health celebrates its 85th anniversary and we embrace the legacy of our health system, we look to our future and all that it holds. Then, now, forever, we are Broward Health.
A starting point. Everything in this world, everything we know, has one. a point in time when a journey begins. Ours began in 1938 with a vision, a mission to provide exceptional health care for the people we serve. And while we call it our starting point, it would also become a turning point for South Florida, the creation of a commitment, the beginning of breakthroughs, the progression of possibilities. Together, we've been building a timeline that has not only saved countless lives, but has also elevated the health of our region.
Broward Health saved my life.
It has shown the most important part of the word community is unity. It's proven over and over that at any point in time, through every challenge, every milestone, every step our community takes, our mission stays the same: to support, to care, to build, to give, to serve. Starting points can happen at any time with the help of rethinking,
We're working hard to make a difference for those who are afflicted by Alzheimer's.
rediscovering,
It's a story of dedication, a story of determination.
even a little remembering. But it's what you do once you've started that ultimately matters. So here's to the start of another 85 years and beyond. Serving Broward County. Serving South Florida. Serving our neighbors. Then, now, forever. We are Broward Health.
All right, this is exciting. Is everyone excited to be here? I love it. I was able to feel the energy outside, and it was explosive. First of all, what was really exciting is that video to me. Our team, our internal team, and I really want to thank our amazing marketing and communications team. That was done totally inside and in-house, and they worked night and day. They put on this event and made sure that we could do it. So to Jen Smith, to Erica, to Javon, Kyler, Carla, and many of the others on the marketing. Thank you so much for what you do for this organization to tell this amazing story every single day. Thank you. Now, before I take you on a journey, because I think that video encapsulates everything so well and gets to walk you through, I was able to pick up on a little chatter out there, and it was really exciting. I had a person say, man, this is the who's who of Broward County. I was with the Donnellys, and they were saying, hey, I think we have quorum for the Broward Workshop Board of Directors to meet. Senator Lemieux asked if there was a fundraiser after this. Our great county commissioners, I saw Mayor Lamar Fisher and Udine, they also wanted to know where that fundraiser was. But don't worry, you don't have to, you could seal up your pockets, they're safe this evening. But then, you know who jumped in? Our CEO of the Broward Center here, and I want to thank him. I don't know where he went, he was there a minute ago, but Shanley, are you still here? Kelly Shanley, he is amazing for opening his wonderful house to us. There he is in the back. And it's great, and I'll tell you a secret. He is, not only is he the CEO, and has he put this place on the map, and he brings the greatest shows on earth through here, but usually he only stays for the first 5 minutes, so it's impressive that he's still here. But Kelly trumped me tonight and said, Shane, they're not here for this or that or all those other things people are talking about. They thought Hamilton was tonight. So I want to thank him, and then I said to him, well, to be honest with you, I told my wife Alexis and my daughter Kate the same thing. We're going to see Hamilton. So that's the only way I was able to get there here. No, so this is extremely special. I want to personally thank everybody here. Our Board of Commissioners that work relentlessly. They're not paid, they're volunteers, and each of them wants to make a big difference in turning the needle and taking Broward Health to the next place possible. And when you look over to the left, these are the sharpest and finest people that you can find in all of healthcare. They're your doctors, your chiefs of staff, your chief medical officer, and your chief nursing officers. And boy, during COVID and other times, they held the fort down. They didn't go home, they weren't with their families. They took care and tended to patients. It's been 3 years, but the pandemic was tough on the organization. But they were here night and day, 24/7. So thank you, doctors, nurses, thank you. All right. So now it's my job, and I'm going to be taking you on a fun journey, one of reflection and inspiration, a vision for our future, as we review and imagine Broward Health now and forever. Our story begins in the early 1900s. Just 20 some odd years after the incorporation of the city of Fort Lauderdale, there were only approximately 19,000 residents of the newly formed city, and they recognized a need for a hospital. Only a few years later, in 1938, the doors of Broward General Hospital opened in the former Granada Apartments, housing 16 units and 45 beds. And so began almost a century of healthcare in our great community of Fort Lauderdale and Broward County. Just 13 days after opening the hospital doors, the first baby was born within our hospital here in Broward County and welcomed to the world at Broward General. And many more births occurred. In that first year, Ted Drum, born in 1938 and is who here with us tonight, was also born in 38. Is Ted Drum here? Would you stand? We have some flowers for you, Ted. We have Ted's daughter, Kathy, is here, and somehow they invited the son-in-law, Robert Reichman, but we love you too. Robert, we're glad you're here. He'll hold those flowers for you, Dad. All right. So, but Ted has been steady and fast and helped the organization over the years. He was recently inducted into Fort Lauderdale's Hall of Fame and has a lasting legacy within Broward Health and all of our cities. So, Ted, thank you so much for supporting Broward Health. However, the first steps did not stop in the maternity ward. The singular hospital for our region, Broward General, broke barriers, becoming a leader in medical advancements. We opened the first pediatric unit in Broward County in the early 40s. The auxiliary was created and is still going strong today, thanks to our hundreds of volunteers across all 4 hospitals and the many other locations. In the 50s, we welcomed medical breakthroughs that would change the course of modern medicine: the polio vaccine, production of penicillin, and to Broward Health, the region's first iron lung, a mechanical respirator. Within the continued population and growth across the county in all the 50s, we broke ground on our second hospital, the North Broward Hospital, Deerfield Beach. And then the 60s heralded perhaps one of the most momentous and poignant marks in Broward Health's history: the long overdue desegregation of Broward Health hospitals. Though he started care for patients at Broward General in the 50s, Dr. Calvin Shirley broke the race barrier, becoming the first black physician on staff at Broward Health. And this evening, we have his daughter with us, Shirley Jasmine. Jasmine Shirley. And following that change for equality and human rights happening across the county, we welcomed our first black patients in 64-65. Perhaps no one can recognize the significance of this more than our very own Thelma Coates, who has served at Broward Health Medical Center for over 60 years. Thelma's here tonight. Thelma, will you stand? Now, I wish others worked as hard as Thelma. When we were speaking a week or two back, you know what she told me? She said, Shane, she said, I was never late, never missed a day, not absent. And so I said, well, what do you tell the new employees? She goes, I tell them, get off the phone and get over here. But she is truly inspiring. They love her. She works hard. She's raised a family of 5, and you are an absolute icon at our healthcare system. Thank you. I had a young physician tell me that you were a beacon of hope for so many. We are proud to call you our own. So representation matters, and I'm proud that our workforce is a true reflection of the communities we serve, with the majority of our employee family being multicultural and multiracial. Our patients know that no matter their age, race, culture, gender, or religious background, when they come to Broward Health, there will be exceptional physicians, nurses, and clinical staff who can respect their heritage and understand their values, leading to enhanced patient care and ultimately better patient outcomes. Much of that inclusive culture continues to permeate Broward Health today because of our intentionality of all of that throughout the 70s and 80s. As people immigrated to South Florida from the islands, Central and South America, we responded quickly by opening Clínicas de las Americas, providing culturally sensitive care to our new neighbors of Broward. When the AIDS epidemic exploded, Broward Health became the first health system in the county to offer a complete network of HIV/AIDS outpatient services that continues to this day with funding from the National Institute of Health. They continue to do the research with additional programming at Broward Health Point and our Children's Diagnostic and Treatment Center. And so, the new millennium of growth continued. We expanded into 4 hospitals and more than 50 locations across the county, creating access to high-quality care for all patients across all 4 corners of the district, from Coral Springs to Weston, from Fort Lauderdale to Deerfield. In the early 2000s, we then unified those many locations under one name, Broward Health. And through our history to now, we firmly established Broward Health as this community's healthcare system of choice. Today, Broward is woven into the very fabric of our region. Broward County is a tapestry of cultures and industries, and Broward Health reflects and touches them all through international programming and rich community outreach. And now, a new path is being forged, driven by exceptional leaders, skilled clinical talent, and an employee family that is knit together with one purpose: to serve Broward County and beyond. Perhaps nowhere in that mission more evident than following the Marjory Stoneman Douglas shooting or through COVID-19 response, as we restored the health of young people who were grievously wounded physically and emotionally, even while mourning their loss, accepted and cared for the first COVID-19 patients from stranded cruise ships when no one else would take them in the world, all while providing the best possible care regardless of a patient's ability to pay. Time and again, we have proven that no matter the circumstance, irrespective of how great the need, Broward Health stands ready to serve. None of these responses come without a price, financially certainly, but more importantly, I think of our remarkable care team. During the peak of the pandemic, our amazing physicians, nurses, respiratory therapists, environmental services staff, and so many others worked around the clock to ensure all patients received the best possible care, often at great personal expense. I look at Dr. Sunil Kumar, our Chief of Staff at Broward Health Medical Center, and an intensive care physician who physically separated himself from his family for many, many months to ensure he did not inadvertently expose his loved ones to COVID-19. Thank you, Dr. Kumar, and all our physicians. And Dr. Kumar, his story was not unlike so many other physicians and nurses on stage joining us this evening and in the audience. The pandemic spotlighted the incredible dedication you, our doctors, our nurses, our support staff display even today as we continue to manage labor shortages and other factors impacting the healthcare industry. If you're a part of a clinical team, would you please stand? Thank you all for being on the front line. And what's even more amazing about tonight is these aren't just Broward Health folks, but these folks represent most of the hospitals in our community. So I want to thank you very much. You have kept our system and our nation's health moving forward. We are grateful to you for not only caring for our patients, but for also enabling our system to explore innovative new ways to bring the best possible care to our community, much of which has already begun. Despite the challenges created by the pandemic in the past 3 years, we have forged ahead with strategic business goals, completing capital improvements like our new cardiac catheterization lab, level 3 neonatal intensive care unit, and launching new treatments in cardiology, orthopedics, and many other specialties. We recently launched Broward Health Point, which is a division of Broward Health which includes 10 clinics that serve our under or uninsured patients, many of whom are homeless, suffering from chronic conditions or at risk for complicated pregnancies. We introduced our new mobile units that bring diagnostic and maintenance care to patients directly to their homes and communities, mitigating access issues that prevented optimal care in the past. It's pretty impressive that the system has set up these RV units that will actually now take health care to your home. We continue to be a leader in procurement. We've recently won many awards. I'll only mention a few, but Vizient National Supplier and Diversity and Advisory Council selected Broward Health, and Florida State, the Minority Business Development Council for the state, also named us. That's just a few. Broward Health annually spends millions with minority vendors, 64% of which stays within the Tri-County region. That's clear evidence of our commitment to supporting local economic growth. Broward Health has also re-engaged with our community partners. Many of you are here tonight. And looking into the audience, I see so many friends from the region's nonprofits. Thank you for what you do. We are proud to work beside you and equally grateful for the resources and support you bring back to Broward Health every single day. As we gaze forward, there is too much to accomplish, and many ways we will continue to look to our business, our elected officials, and our industry partners to collaborate. As an industry, healthcare faces significant obstacles, and only through collaboration can we find meaningful solutions for the community we serve. And that work has already begun. In 2024, Broward Health will open a new freestanding emergency department in the city of Sunrise in partnership with the Memorial Healthcare System and Joe DiMaggio Children's Hospital. I saw some of our fellow Sunrise City Commissioners tonight. I want to thank them. Commissioner Douglas, thank you very much. What has long been considered a medical desert in your community will now boast exceptional emergency care for adults and children. Thanks to the outstanding work of the Memorial Healthcare Systems Board and the Broward Healthcare Systems Board, we are able to move forward on this joint project, a first. Thank you, Commissioners. We are also exploring additional opportunities to work with other health systems to optimize and expand care offerings for patients and their families. Tonight, I'm pleased to announce a new partnership that will revolutionize medicine for Broward and Palm Beach counties. Please join me in celebrating our new collaboration with Florida Atlantic University. And I want to thank them for being here. I want to thank the interim president, Stacy Volnick. Can we get the lights? Oh, excellent. Our medical school dean, Julie Pillis. There you are. Our chair of the board of trustees for FAU, Brad Levine. Behind him, the vice chair, Barbara Feingold. You all make it happen. You recognized our vision of how together we can excel medical education, health service administration, and clinical research. The folks and the names that I spoke about a second ago are really making a difference. When you have a university's medical school, the dean, Julie, you have the interim president, you have the board of trustees like Brad Levine and Barbara Feingold, you can move mountains. There's no reason we should not have regional cooperation, bringing healthcare and academic centers together who are in our backyard. So, FAU, thank you. Broward Health could not be more excited to formulate how FAU's medical school and our health system will transform medical education and patient care in the coming years. And the collaborations don't stop there. Do we have any Gators here tonight? All right, then start chomping, because Broward Health will also continue to propel research that began just this summer with our new Alzheimer's clinical trial in partnership with University of Florida Health and Inside Tech. That's good, it's worth clapping. This groundbreaking research is the first non-invasive, non-pharmaceutical solution to Alzheimer's treatment, testing whether breaking the blood-brain barrier through focused ultrasound can have a meaningful impact of the progression of this terrible disease. Medical advancement is only possible through research, and we will forge forward in numerous clinical trials across neurology, oncology, cardiology, and the other specialties. In fact, Broward Health will also be the first in Florida and 5th in the nation to offer the latest robotic cardiac care with the impending opening of our stereotaxis lab for patients with arrhythmias and other heart conditions. We're exploring, look at that. As your level 1 trauma, we see a lot of strokes and heart attacks, so keep us in mind. All right, we're exploring opportunities with patient rehab, other areas, neurosciences, and orthopedics. And we remain committed to graduate medical education for our physicians and our nurses. As the first statutory teaching hospital in Broward County, Broward Health has long been committed to ensuring our community has the clinicians necessary to care for the health needs of our neighbors by growing our residency programs across all 4 of our hospitals and adding new specialties. And that is just a small sampling of what we have planned for the coming months and years ahead. I could share more, and I saw CEO Scott Wester of Memorial, I saw Bernie Fernandez from, I think it's of Baptist, but there's a lot, Holy Cross is here. I'd like to share a little bit more, but I probably better keep some of those secrets quiet, so, but I do want to, but, you know, we've talked about collaboration, and that's part of that silver lining throughout COVID. I mean, we had an opportunity to work with Aurelio Fernandez, the former CEO of the Memorial Healthcare System. He's been just a 40-year pro, a mentor, and a good friend of mine for many, many years. Scott Wester has been here, and over those 8 months has integrated into the community and working well with his hospitals. Dr. Fernandez with Baptist and Dr. of Cleveland Clinic and Mark Doyle at Holy Cross are really making a difference. That silver lining from COVID is we can work together, we can collaborate, and we can do more for our communities. So thank you all. Your thought leadership and investment are critical to our ultimate success. I would be remiss if I didn't thank several who have already grasped our vision and demonstrated their commitment to Broward Health and in our community. Dr. Rita Guruli-Chidiak and Dr. Anthony Chidiak recently donated a medical office suite to the Broward Health Foundation. Doctors, would you please stand? Actually, Dr. Rita Guruli-Chidiak is a retired family medicine physician, and Dr. Anthony Chidiak continues to serve Broward Health with patients as an OBGYN, so thank you. An independent appraiser valued their donation suite at over $1.1 million, but the value is truly priceless for what they've done for us. On behalf of the entire Broward Health Foundation, our president, Scott Ford of the foundation, thank you for your generosity. Just last month, one of the Broward Health Foundation's very own board members recognized a significant opportunity within our graduate medical education program. Mark Kent, can you please stand? I love this guy. He's the best, and he is a serial entrepreneur, and he puts his he wants to put his money back into the community, so I'm going to share something, Mark. He's a longtime advocate for minority education, and Mark recently gifted us $500,000 to programming ensuring that expenses for minority physicians completing their residencies are covered. Thank you, Mark. It's also Mark's birthday, so after this, there's going to be coffee, and there's going to be dessert. Seriously, there really are, and he's picking up the tab, so thank you, Mark. That's a joke. Actually, one of our other board members, Pam, is going to do that. And if Pam's not doing that, we usually turn to, actually, all of these board members who dig deep. But I like to look at Ray Berry, and I like to look at all the gentlemen up there, Chris Pernicano, and I think he's trying to hide on us. But a moment ago, John Hage, so he's usually a go-to on that stuff. So we're doing really well on everything on that side of the house, but this summer, this is really exciting. So the foundation has really taken new steps under the leadership of Scott Ford and our executives and really getting back out in the community and telling our story. And this summer, we received one of our largest one-time donations ever. Marvin Weiner and Jackie Bernstein, after Marvin received exceptional care at Broward Health Imperial Point, he believes so much in the healthcare system. I get a little choked up. We lost Marvin to cancer, unfortunately, a few weeks after that. But you know what? His gift and family still gave us $5.5 million to make a meaningful impact. But talk about patient care. We didn't know who they were. They believed in the organization, asked how they can help. The CEO of Broward Health Imperial Point, Judy Frum, their chief medical officer, Jerry Capote, were there, talked to him, met with the nurses, every single person he thought was absolutely wonderful, couldn't believe it. So he wanted to make sure he was able to do something for us. So we really appreciate them. We were actually going to be building and putting a whole plan together. So a lot of great things are going to happen. We'll prepare to open really an imaging center for them shortly. So tonight, I would ask you, what can you do to help our community? Would you consider investing time, money, or resources to Broward Health? The Broward Health Foundation supports our strategic plans, and there are numerous opportunities for you to make our dreams and needs a reality. Whether you donate to the foundation, attend one or more of our upcoming events this spring, or just volunteer at one of our hospitals, I encourage you to be a part of our history. For the future has never been brighter for Broward Health. We are pursuing excellence through innovation, new technologies, and the determination of our family. Our exceptional Board of Commissioners drives our organization to greatness with unified leadership and thoughtful business insight. I want to thank the board. I'd actually like them to stand up for a moment. This is a board of commissioners that is solely invested in making sure Broward Health goes to the next level. They give their time. They're extremely generous. Even though John Hage tried to duck out a second ago, we're going to get a donation from him shortly. We saw you, Mr. Hage, Commissioner. But this board really has done so much in the last. Their commitment to the organization is what's really moving the needle for us. I was talking to James Donnelly tonight, and we were talking to several other people who said they feel this magic, this energy, that we're moving in the right direction. And I couldn't be more proud of that board for helping us put these wins on the board, but being singularly and narrowly focused on advancing this healthcare system for everybody. So, board, thank you for being so good. You know, and if I can, I'm going to also recognize, I know that we have our South Broward Hospital District Board of Commissioners here. If they would stand for a moment to be recognized. All right. You didn't have to turn the lights on for them. Just a joke. Just a joke. We're working well with our partners to the south. In fact, we really are working well with them. We've had 3 official joint board committee meetings. That's something that's never been done before. I want to thank Scott Wester and his executive team. I saw Matt Newhart, Nina Beauchene, David Smith, so many of the Memorial Healthcare System. If we could give them the spotlight and a standing applause. Aurelio, please stand. So thank you. We have recruited talented executives who have made immediate impacts in their roles and the hospitals they lead. You heard Stacy Angers speak about them and identify them. And our chiefs of staff, our medical officers, and our chief nursing officer. Would you rise? We appreciate all that they do, but they're making a big difference in technology, research, new treatment protocols, and really making a difference at all the many locations, ultimately bringing clinical excellence to our system. And as evidenced by the turnout tonight, we have you, our community. You are our greatest asset. The future is now, and with your support, imagine what we can accomplish for our county and South Florida. Thank you for letting us not forget that just then, now and forever, Broward Health will be here to serve our community.
Thank you, Shane. What an evening. I don't know about everybody here, but I've never been prouder to call Broward County home and Broward Health my healthcare provider. Before we close tonight, we do have a surprise from our friends at the Broward Center for the Performing Arts. In celebration of Broward Health's 85th anniversary, the Broward Center will be raffling 8 pairs of tickets to upcoming performances. I'd like to ask Kelly Shanley, President and CEO of the Broward Center, to join me on stage to draw our winners. Kelly.
Hey, everybody. I'm going to be kind of brief because, Hamilton's coming on stage. That's 2.5 hours. I want to get you out of here at a decent hour. No, but thanks for letting us do this to recognize this special occasion. And thanks to Shane and the board and his team for being such great stewards of such an important and enduring institution here in our community. So yes, like Joe said, we've got tickets to 8 upcoming performances, 85 years. We chose, all 8 decades. I'm going to announce your name. These were drawn from people who responded to attend tonight's performance. You don't have to cheer for them. They can cheer for themselves if they're here. But I'm going to just read off a list of folks who we will then contact by email. We've got a lot of great shows coming up. Cheetah Rivera's coming, Itzhak Perlman, comedian Paul Reiser, The Mikado by Gilbert and Sullivan. Lots of great shows coming up. You'll have those to choose from to get your 2 tickets. Okay, so without further ado, our winners are Kathy Koch, Vilma Rivera, Terry Chatterton, Ron Lothar, Katarina Perez, Mark McCormick, John Ray, and Adriana Aponte. Congratulations.
Thank you, Kelly. Now we invite you to join us for coffee and desserts out in the lobby, and you can also enjoy Broward Health's timeline as well as some great networking. Don't forget to collect your gift before you leave tonight. Thank you for an incredible evening, and happy 85th anniversary, Broward Health. Good night.